this video is something you would like to watch. Very, very important. Hematology, really good case study, but at the same time, content review for hematology and case study for your NCLEX. So stick around and join me as usual to learn something for you as you prepare. Hopefully this will help you. A client in the emergency room. So I know I got to do something. An emergency, I have resources to take care of this patient. What is this scenario? A 20-year-old, it's very important, was brought in by the emergency room after the parents called 911 due to what? Fatigue, dizziness, weakness, decreased PO intake, and abdominal pain. A bunch of symptoms. That should tell you something. Also complain of what? Severe multiple joints pain, arthralgia, and back pain for 12 hours. So multiple pains everywhere. It just started all of a sudden. But what causes this problem? Client symptoms began after he returned from a 4-day hiking tournament. That is your key. I've been outside for 4 days. All of a sudden, fatigue, dizziness, weakness, and then I have abdominal pain. Client report, he said, for episodes of similar symptoms after prolonged outdoor sporting activity. These are all clues to give you an idea. Something should be ringing as you read. It should be occurring to you as you read, as underline them, that this is what we're talking about. Deny any sin contact. So nobody is sick that you get it attached to them. And there's no fever or chills. Feel nauseated and does not want to eat anything because of decreased PO intake, right? What is his past medical history? Recurrent pneumonia. That is your clue. Why this patient keeps on having pneumonia all the time? Also had cholecystectomy. They remove the gallbladder. And you take this medication, hydroxyurea, some Motrin, and Tylenol. He has no allergy. Have you been able to figure out your buzzwords and what the key is asking you? What is the problem? Rapture is okay, but slightly tachycardic. His respiratory rate is going up. His sight is going down a little bit. How does he look on the bed? He's groaning and grimacing on the bed. His mucous memory are pale and dry. Tell you dehydration, right? His lung is fine. His heart is okay. His abdomen, tenderness, and you can feel the spleen, keywords. His back, he has moderate tenderness. His knee, moderate tenderness. And then there is this. Reticulocytes, 8%, usually 0.5 to 2%. These are small red cells, and they are immature. They are immature red cells. That means your cells are dying to the point that they're making too much immature cells. Have you been able to figure out what are your buzzwords? Buzzwords are the general symptoms we describe about fatigue, dizziness, abdominal pain, then joint pain, in addition to being out for hiking for 4 days. He's had this before whenever you go outside, okay? But he has no sick contact, right? So it's not an infectious problem. He's had multiple recurrent pneumonia and they remove his gallbladder. He's on this medication. That's a clue that will tell you, hydroxyurea. When you examine them, the kid is groaning and grimacing on the bed. That's bad. His lung and heart is good. This rule out other symptoms. You can feel his spleen is bad, and he has tenderness with this. What do you think this is? You should be able to make a diagnosis. And this is a problem due to sickle cell. So this patient has a sickle cell, and it's in vaso-occlusive crisis. So that is the key. Buzzwords I've given you: diagnosis, sickle cell, and vaso-occlusive disease. This is the way they will present it. They always have to give you a good scenario that is common to everybody. So that's the way they will present it. Somebody with dehydration activating this process. Highlight information that need further intervention. When you need further intervention, that means something that you have to work on it right away and give you some idea about the diagnosis, okay? So something is not right. Reticulocyte of 8% is almost like 4 times what is expected. So we need to do that. A spleen is palpable. This is not good. I'll tell you later. Stick around to watch this. Heart rate, we saw signs of dehydration, right? Yes. And he has joint pain. This is all vaso-occlusive disease. Recurrent pneumonia, what can you do about it? It does not have pneumonia now, so I'm not worried about it. It take hydroxyurea, I'm not worried. I don't need any further intervention, right? So the patient is experiencing what? Vaso-occlusive crisis or associated sickle cell disease, right? That's the problem. There's a dehydration, the cells are dying, being broken down, forming and basically a clump of red cell that's sickled. And if this is your muscle and this is your blood vessel, they're being occluded by the cramp of sickle. So there's no blood going to the muscle. And that's how they give you the pain, muscle pain and the cramp. And then all the pain we're getting from is vaso-occlusive. So that's the problem. Now, which of the following is indicated? I've told you the diagnosis. What do you want to do? I just draw this as an example. If this is the muscle, and this is the vessel, and this is the circle blocking blood flow, so blood is coming, it can come. What do you want to do? So that's the management. They need the IV fluid. Multimodal pain management, when you see it, I use this word in case they put it there. I'm just trying to give you anything. You don't want to prepare for everything. Not just pain management, multimodal, so they can get NSAID, they can get opiate, even PCA is much better for them. So multimodal, that means not just one type of group of pain management. You can combine NSAID, antidepressant, all those things can be used for pain. So opiate and NSAID. So that's why it's multimodal. Hydroxyurea is for chronic, is to increase fetal hemoglobin. And that is for ongoing treatment. In acute form, it does not do anything anymore. So that's irrelevant. Lumbar puncture, yeah, you don't need to do that. CT of the head, they can get stroke, right? But it's not part of the pathway. The case does not show you any signs of stroke. So the clot can clog the blood vessels going to the brain, it gets stroke. So, but there's no HCT that is indicated based on the physical exams I've given you. You always have to, based on what you're thinking, don't bring whatever you know. Based on the history I've given you, I never show you that the kid has any neurological problem, so it's not indicated. Head of the bed less than 30 degrees. This is good. You want to keep them in a neutral position and straight so that they don't move too much. Their head, when it's greater than 30, it causes more pain. So you want to put it less than 30 degrees. So this is good. Loose fitting cloth. Yeah, when you put any cloth, like even IV cuff, blood pressure cuff, when you squeeze it too tight, it causes too much vaso-occlusion. They're already having vaso-occlusion. So anything that is tight, you should take it out. So loose cloth fitting. When you're checking the blood pressure, you got to be careful, not too tight. And so this is good. Of course, oxygen therapy to improve the oxygen, right? The tissues need oxygen and hemoglobin, which is going to bind to the oxygen and take it to the cell. So you need to give it to them. And you transfuse them as needed because they are reticulocytes. It's about 8%. So they need transfusion. So this is indicated. So these are all what is indicated. 1, 2, 6, 7, 8, 9. It's a select or apply. Okay. Just pick those that be confident. If you don't know all of them, pick. Don't guess. There's 6 of them, okay, and there's 9 answer choice. So you pick those that you're confident. If you pick too much, you lose more points. So just select those that you know. If you know only 3, this is okay. I know you know because I've given you the information. You know very much. So you should be confident. You based on your knowledge. That's why you don't memorize. Pay attention to keywords. And you know that well, I need to do this. I need to do this. I need to do this. Now, select two. And now I'm telling you to select two priority actions from the above. Which of these 9 is most prioritized that you have to? That's another way of asking it. The first one asks you to select which is indicated. But now I want you to tell me 2 that is very, very important. And I describe it to you. I give you keyword. The muscle or the tissue dying, and there's cramp here. That's the sickle cell. How can you get rid of this sickle cell? Flush it with fluid. And you will flush everything out. And that's why IV fluid is number 1 for this patient. Then you treat the pain, the muscle that is dying, the pain is causing, then you treat it. So we give them multimodal. So these 2 are the most important. The rest is not important. They are more important than blood transfusion. If you can stop the sickling from cramping and then blocking the vessel, they will be fine. Their pain go away. So they are in pain crisis. IV fluid and pain management are your priority actions. Okay. Now, number 5. The nurse received 4 additional patients with sickle cell who should be seen first. I'm trying to give you enough information. Usually the case doesn't go away. But like I said, this is just a context to help you with sickle cell. So in case you see this standalone question, a sickler, she was taking care of 1, and now they brought 4. They say, oh, who would you see first? These 4 people. Who? They all have sickle cell. Which one do you want to see? Okay, this should be 10. Which one do you want to see? A sickle cell client with 8 out of 10 knee pain, a sickle cell client with 8 out of 10 shoulder pain, sickle cell with prominent palpable spleen, and a sickle cell with a heart rate of 105. You have to be sharp. And when you are being sharp, you're looking for something that will kill the patient. At the same time, you got to go with your content. Sickle cell, what is the problem again? I keep on drawing this to let you know that that's the pathophysiology. This is blocking this, and there is tissue are dying. So your spleen, which is that usually like that, is usually in sickle cell patient, it's very small because it's already dead. It's infected because it doesn't have blood supply. So sometimes it get infected. So this is normal spleen for patient who have sickle cell, very, very small spleen, right? So this patient's spleen is big. What does it tell you? We call it sequestration. Okay, sequestration of blood. Now this blood, all the blood is pooling in the spleen and is sequestrating. When you see a sickle cell patient with the big spleen, this is what it means, big spleen. That means it's deadly. You're about to die. The spleen will rupture. That means the blood in it will rupture and you will have hemorrhage. Any sickle cell patient with the enlarged spleen means there is a pending rupture of the spleen and they will die. And so because of the blood loss, hemorrhage, intra-abdominal hemorrhage. So the person you see knee is not going to kill you. Shoulder, I'm not being killed by that. Heart rate, I've not told you they are in arrhythmia or anything like that. So when you are being sharp, you're thinking about a shock patient. This guy will be in shock. You have to interpret it. So a prominent spleen is the person who sees that. Client was ready for discharge. So now they want to go home. And he asked the nurse about complication of sickle cell. So what are the complications? If you have sickle cell, what are the complications of it? So this is your blood cell, that is sickle. When it breaks down, it releases hemoglobin. Hemoglobin has what we call bilirubin in it. This is bilirubin that gives you jaundice. So one of the complications of sickle cell is jaundice. So this is true. Splenic infarct. Yeah, I explained it to you. The spleen becomes small and it dies. It's infarcted, so it doesn't do what it's supposed to do. Stroke. Yes, they form cramps that can go to the brain and block it. So stroke is common in these patients. Acute chest syndrome. This is the deadly one. This is what killed them. Every sickle cell patient that comes in with chest pain, they having acute chest syndrome. So any respiratory problem, that's fever, in the sickle cell patient, that can come in acute suddenly with the chest pain. Yeah. Respiratory issue, fever, and chest pain is acute chest syndrome. And they will have shortness of breath, they have respiratory issue, and this is what kills them. This is where they will need a lot of support. This is different. Acute chest syndrome is different from this normal vaso-occlusive disease. Acute chest syndrome usually associated with vaso-occlusive, but we classify it acute chest syndrome because all their symptoms is mostly chest pain, shortness of breath, diaphoresis, respiratory failures. Yeah, that is serious. Acute is different from just regular vaso. So vaso-occlusive symptoms with respiratory problem, yeah, major problem of respiratory is acute chest syndrome. And so when the patient asks you, so what is, client want to know what is acute chest syndrome? Yeah, that's what I explained. We have mostly chest, respiratory symptoms, in addition to some vaso-occlusive, and this is what kills them. Their mortality is from here. We have to support them really well. Okay, that's it. And finally, I just like to say, giving you content to help you answer any questions sickle cell. I don't know what it will give you, so this is what I'm giving you, my best. The client report that his girlfriend is a carrier for sickle cell disease gene and want to know the risks to their children. This is something you have to know. Be able to do Punnett square. Okay, so everybody have two genes, okay, in their chromosome. So usually you have like a normal people, okay, and if you have sickle cell, it will be small s, or you can use big S for the AA. But I'm using AA as normal, and you have sickle, is sickle cell, small s. So this is sickle person. So the normal gene is what? A, and then the sickle is what? X, right? Or I can change it in order to make it a little bit better for you guys. Let's use the normal as the big S. So normal people, big S and big S. So normal gene is that. This is normal gene. And small s is a sickle gene. If you are a carrier, that means you have one normal gene and one sickle gene. So this is the sickle gene. This is a normal gene. This is normal. So this is normal person. This is carrier. And this is a circular disease. This person live a normal life. They don't show any signs of sickle cell, even though they have the gene, because the bigger S is helping you because they have a normal gene available. So that help with that. Okay. So to answer this question, you have to do something we call crossing. So you ask yourself, the patient, right? That's the client. What is his gene? He's sickle cell, so he has two small s. The girlfriend is what? It's a carrier. So what is the girlfriend would be? The girlfriend would be this one. Big S and small s. So that's what you're going to have for that particular patient. So that's what you have for that. So that's the girlfriend, big S, small s, the patient, two small s's. So now you got to cross them. How do you cross them? Just do a Punnett square. There's 4, right? Genes. So I draw something like that, and I cross it, and I take the boyfriend on top. That's what S and S, and I put the girlfriend here. Girlfriend has what? Big S and one small s. And you cross it. Big S times small s. You have big S times small s. Big S times small s. Big S times small s. Small 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 s times small s. Then you ask yourself, how would these people look? Big S times small s is a carrier. Big S times small s is also a carrier. Small s and small s is a sickle. Small s and small s is a sickle. That means half will be a carrier, and half will have a sickle cell. So the chance of having a sickle cell patient is always 50%. So when they're going to have a baby, the mommy is pregnant, there is a probability, it's a coin flip, that the baby is going to be a carrier, which will be normal, or the baby will have a sickle cell. So they have to think that this relationship is not great. There's 50-50 chance that whenever the girlfriend is pregnant, it's going to be a sickler, or it's going to have a problem, or it's going to be a carrier, or it's going to be normal. So you ask yourself, who should he marry? Right? Who should he marry? He should go and marry, somebody who is normal. If that person is normal, it will be SS. Big S. So big S, big S. And this is the person, the patient client. So this time this big S, big S. Big S, small s. Big S, small s. Big S, small s. All of them are carriers. So there will be 100% carrier who will live their life normal. But this current relationship will affect the children a lot. This is just to give you some ways they can ask you questions about it. Like I say, it's a content. I want to give you everything you need in case they go there. This is the end of it. Thank you for your time. Thank you for listening and getting to the end and getting the most important aspects of the case. All the best of luck and have a good day.